Good morning. So for all of you in the audience wondering what's a pediatric ophthalmologist doing in the retina session, I think you'll know by the end of this session why. During my training in pediatric ophthalmology as a resident and then also as a specialist and then a subspecialist, I had this dream in my mind, how to save those neonates. About 12, 13 years ago, it was a dream. Any child or any neonate who was premature and had retinopathy of prematurity, he would be labeled blind until proved otherwise. First of all, I would like to say I have no financial interest. The beginning was here. When we started at the 2012, 2011, receiving premature neonates with retinopathy of prematurity. And as any intelligent or brilliant idea is always by brilliant people. My friend and my tutor, Dr. Zaid Rajab, one day I was sitting in the morning having breakfast, and he asked me one question: what are we going to do with these children? Is there a hope? So this was the beginning. Now I have had families, and I have always asked myself what a blind child or neonate would think. He would always say to himself, why is this world so dark? And when he grows up, he cannot see his mother, and he doesn't know why. And when he grows up more, he will know or label himself blind. Now imagine my name is a space. For all of you in the audience who has a child, and if he puts his child's name into that blank space, what would he think? Our mission started with Dr. Zaid's idea and with me, and then Dr. Susan joined in. It was a mission to save vision, but also it was a mission to give hope. A hope to the child and a hope to his families. The 7th of April 2015 was a very, very special day for me. On that day, me, Dr. Zaid, Dr. Susan, we were gathered up with the Ministry of Health. And we made a session giving an alert to retinopathy of prematurity. And from there, the retinopathy of prematurity screening program in Iraq started. We made a flow chart, and all these hospitals you see would send the premature neonates to us to screen them with the RedCam. Of course, we labeled these risk factors: any gestational age less than 32, as we know, any birth weight less than 1,500, high O2 exposure, although this is now questionable, white male bone, multiple births, birth transfusion, other risk factors. These were all labeled for these children. They were considered as high risk factors for ROP. When did we start the screening? It was at the beginning of the 4th week of chronological age, or 31 weeks post-menstrual age, whichever was later. So if the child was born, for example, you can see here, 28 weeks, we would see him after 4 weeks to screen him. And then we would do in the minor operating room under topical anesthesia with pupillary dilatation using this brilliant machine, the RedCam 2 by Clarity Medical Systems. This was a machine designed in 2007. For our luck, luckily for us, we have two, thanks to Dr. Ammar who bought it for us. And actually, this machine is my life. I spend my life, most of my day, working with this machine. And then we made this, a screening form. We would label the patient's name, his risk factors, and then draw which stage of retinopathy of prematurity you would be in. And then there will be the follow-up. As we know, although personally, myself, I have many points against this classification of type 1 and type 2, but this is what is written by the experts, and this is what we should follow. So if it is a type 1, we should follow him up closely after 1-2 weeks. If it is a type 1, we should treat him. If it is a type 2, we should follow him very closely in 1 or 2 weeks. Now, this is the follow-up according to the stage of type 1 or type 2. And if the child needed treatment, if it was type 1, worldwide we have 3 options. The old therapy, as we know, is the cryotherapy. It's now nearly abandoned. And then we have the indirect laser according to the early treatment retinopathy of prematurity study. And now we have the magic drug. It is the anti-VEGF. As we know, the available anti-VEGF drugs, we have now 3, and then there's the 4th. Regarding premature infants, we all know, and we have all of us have heard about the BTROP study that was conducted in the United States. The BTROP study used Avastin, or bevacizumab. But the problem with us in Iraq, it's first of all off-label. Second, we have a premature neonate who has growing organs, especially the kidney, especially the lungs, and there is a risk of whatsoever. And this risk, we have to take it. So, the second thing is that ranibizumab is available, and it is available by the MOH free of charge. So, thanks to the help of our brilliant director, Dr. Ammar Fuad, he reserved those injections only for the premature neonates in our hospital. And it was a very, very critical decision made by him, and he fought many authorities for me and for the neonates. Between October 2015 and February 2018, we started conducting the study in our hospital in Ibn Haytham. Out of 116 eyes of 59 neonates with type 1 ROP were involved in the study. Those were type 1. We diagnosed them, we documented the stage, and then an informed consent, we explained thoroughly to the family what we will give and what will go on. And they understand it fully, that this is the only hope here now. Of course, I'm a pediatric ophthalmologist. I do not give the injections. But I have brilliant vitreoretinal ophthalmologists, as Dr. Farid noted this morning. So we had 3 actually vitreoretinal surgeons who tackled this enormous task. Dr. Zaid, Dr. Muthanna, and Dr. Ammar Abdul Razak. It was a challenge, and we all were in the same team and fighting the same condition. We did it in the major operating room under sterile conditions and in the presence of an anesthesiologist. Yes, it was under topical anesthesia, but a specialist anesthesiologist was standing there for anything that may go wrong. As I said, it was provided by the MOH. Post-op, we gave them antibiotic drops, and we started following them on week 2, 4, and 8, and then monthly for 4 months, then every 2 months until the age of 2 years, and then till the age of 3 years. And I'm still following some of them now. The results were amazing. I could not imagine in my life that this would happen. Even in the best optimistic fantasy in my mind, I did not realize that out of 116 eyes injected, 105 had complete total resolution. It was like, I don't know, it's like a fantasy. On the next week, we would do the red cam and everything is gone. 11 eyes, yes, they had progression, and it's reported in the BTROP study, there was progression, especially those in zone 1. ROP. Then, out of those 11, after 1 week, 4, we repeated the injections. And Dr. Muthanna was very, very brave to give the second injection because it was a risk. And out of those, 4 also had complete resolution after the second injection. We were left with 3 cases that progressed to stage 4. 2 of them went outside to perform the pars plana vitrectomy, and 1, Dr. Zaid, I don't know, I can't see Dr. Zaid, he performed the the third one, and he's doing very well. I saw him last week. This is an example. Just look at this. This is a plus disease in zone 1, as you can see. And this is just 1 week after. Just look at that. There were no ocular side effects whatsoever, and no systemic side effects. We were looking to two specific things: the apnea, because it involves the lungs, and the kidneys, also renal dysfunction. After about 2 years, I had 3 children with myopic shift, and it is reported that myopic shift occurs in retinopathy of prematurity, whether treated or not. Those that have undergone paraspinal vitrectomy had good vision in their eyes. And so, at last, after many years, my dream came true. My dream came true not because of me, it's because of teamwork. Dr. Zaid had the idea, I started, Dr. Suzanne jumped in, Dr. Zaid, Dr. Ammar, and Dr. Muthanna, and Dr. Khitam. They were all together, we worked as one team. And for them, I have this, I want to thank them all. And I have a gift for you. Last month, I had a report from the Journal of Clinical and Experimental Ophthalmology, and a letter from the editor that said, this was the most perfect paper written for the past 2 years. And I have these papers for you guys. So if you would like to come, I would like them to present them to you. Please, Dr. Ammar, Dr. Suzanne. Dr. Zaid, Dr. Khitam. Dr. Suzanne, she's not here. Okay. So this is the team. I hope she will come because she was a great help for me, really. Everyone, you did a great job. Thank you. So, thank you. I have some final words for everyone here. Sorry, I'm taking a lot of time, but... Hello. Yeah. Now, in my life, I have had, I have had lots of pressure in my job as a doctor, as an ophthalmologist, and sometimes that pressure is, you know, you can take it. Dr. Susan, there she is. Come on up. Please, everyone. This is my gift. Okay, thank you.
Thank you for everybody. حقيقة أحب أشكر أساتذتي اللي حاضرين. أحب أشكر طلابنا اللي أصبحوا حالياً هم أساتذة. وأشكر أكيد دكتور علي لأنه he is one of the best. Really, he is one of the best. One of the best of my colleagues. He is my friend, he is my brother, and he was one of my best students. وأنا أفتخر به وإن شاء الله وأكو هواية غيره. وكلكم واعدين وإن شاء الله تستمرون بالمسيرة اللي إحنا بديناها واللي إحنا أخذناها من اللي قبلنا ونشكر أساتذتنا الموجودين واللي ما موجودين إن شاء الله يكونون موجودين ويانا وشكرا جزيلا.
Now, I have just a final words to share with everyone here. Now, in my life, I said there was a lot of pressure, and there were certain times that I wanted to quit everything, not just ophthalmology, every medicine. I think if you here knows. And every time I reach on the edge of taking that big decision, I get a wake-up call. I don't know, it's a sign from someone I don't know. And one of these wake-up calls was this beautiful child here. This is Ali. Ali was case number 11. I didn't know him. And he came into my office last week, and this big smile on his face. I didn't know him. The mother told me that she was telling him stories about a Superman who saved his eyes. And he called that Superman Ali, and he came to see the Superman. And he didn't believe it was a human being. He was touching me. And really, really, at that moment, I really cried. Because when I put my head on the pillow at night and think why I am taking all this pressure, I think Ali has the cause, and he has the answer for all of this. Thank you, everyone.